The human excretory system comprises a pair of kidneys, a pair of ureters, a urinary bladder, and a urethra. A pair of kidneys filters the substances and eliminates the waste particles from the body. And these waste products, which are the byproducts of metabolism, leaves the body as sweat, urine, and feces. This system is a crucial biological component that removes the additional or waste materials from the body in order to keep homeostasis. What happens when the functioning of any part gets failed? What happens when the nephron's functioning gets altered? Let us find out the answers to these questions through this video. Recall that humans are ureotelic organisms as they excrete urea as a waste product. Have you ever thought about what happens if the kidney stops functioning, that is, losing its capability to filter waste substances? Yes, this would lead to the accumulation of urea in the blood, and this condition is termed as uremia. So, what are the major symptoms? The symptoms of uremia are nausea, fatigue, loss of appetite, mental confusion, and metallic taste in the mouth. Uremia leads to kidney failure. If not treated at the appropriate time, this can cause serious problems. So, the next task is to get all the waste urea contents removed from the body. And how is this done? This is done through another process termed hemodialysis. In the hemodialysis process, the blood is pumped into the dialyzing unit called an artificial kidney. We will learn the mechanism later in this video. You are advised to drink plenty of water. However, have you ever questioned why? The reason behind this statement is that if you do not drink enough water, then all minerals and crystalline salts would accumulate in your body. Sometimes, there is a formation of a stone or an insoluble mass of crystalline salts of oxalates within the kidney. This condition is renal calculi or kidney stone. These stones may develop and expand, blocking the kidney tubules, ureters, or the urinary bladders. And these obstructions can be extremely painful too. This condition causes no permanent damage, but medication is required if the case is severe. Now I will ask you a question. Can you recall the filtering unit of the kidney? Yes, you are right. It is a glomerulus. These are like a ball of capillaries and they are contained within the Bowman's capsule, the cup-shaped structure of the nephron. If you check the structure of the nephron, you can locate the glomerulus and the Bowman's capsule as well. So think for a while. What happens if the glomeruli get inflamed? There could be conditions where the glomerulus get inflamed. Sometimes it can be acute or chronic, and this condition is glomerulonephritis. So far, we have seen some disorders which get developed due to the decreased action of a particular part of the system. Then, what if the whole kidney fails to filter the blood? This situation is termed as a kidney or the renal failure. Depending upon the level of damage, kidney failure is classified as acute or chronic levels as well. When both kidneys abruptly quit functioning, acute kidney failure happens. The chronic renal failure is a steady loss of kidney function over time. Let us now check the treatment methods. Dialysis and kidney transplants are two options for treating kidney failure. To reduce the possibility of rejection by the host immune system, a functioning kidney from a donor, ideally of an immediate relative, is utilized in transplantation. Now, let us focus on the mechanism of artificial kidneys. It is a life-saving process for kidney patients. Here, the excess urea is removed artificially. And this process is used to filter out blood by excretion of urea. In hemodialysis, blood is pumped into the dialyzing unit through a radial artery. The blood is pumped into a dialyzing machine from an accessible artery after including a blood thinner like heparin. And the apparatus includes a coil of cellophane that is encircled by a fluid, that is a dialyzing fluid, that is otherwise identical to plasma in composition, with the exception of nitrogenous waste. Molecules can travel through the porous cellophane membrane of the tube according to their concentration gradient. As there is no nitrogenous waste in the dialyzing fluid, these wastes can freely exit, cleansing the blood. Antiheparin is added to the cleaned blood before being injected into the body through the vein. One cannot overstate the importance of an efficient excretory system. It keeps one healthy and free of various serious health problems. Now, let us summarize what we have learnt.
Manorama Horizon. Learning made simple.